Hey there. If you've been living with this heavy, dragging pelvic pain and you've been told, oh, it's just normal, or that absolutely nothing can be done, well, I really need you to hear this. I'm a senior pelvic floor physiotherapist over at Ova Women's Health, and in today's Explainer, we're diving deep into the truth behind a wildly misunderstood and frankly misdiagnosed condition, congested pelvic syndrome. For way too many years, women have suffered in total silence with these symptoms that literally disrupt their entire lives. So we're going to break down exactly what's actually happening inside your body. I want to start right off the bat with the most important thing I'll probably say to you today. Your pain is real. It is absolutely not in your head. So many women with chronic pelvic pain spend years, literally years, bouncing from specialist to specialist only to be totally dismissed. Maybe you've been told your discomfort is just, part of being a woman, or maybe that you just need to manage your stress better. I hear this from my patients every single day. I am here to tell you definitively, this pain is not normal, and no, you don't just have to live with it. So let's take a deep breath. Those incredibly frustrating, totally unexplained symptoms you're dealing with day in and day out, they are part of a real, verifiable medical condition, and it has a specific name. Look, you have been patient and resilient for long enough. There is actual evidence-based relief for what you are experiencing. We understand the mechanics of chronic pelvic pain so much better now, and today we're going to map out exactly how you can finally get that relief. Okay, so let's get into what this actually is. Congested pelvic syndrome, or CPS for short, happens when the veins in your pelvic region get dilated or basically fail to pump blood efficiently back up to your heart. I always tell my patients it's kind of like a massive traffic jam in your veins. Because that blood just pools there, it builds up all this pressure. That stagnant pressure stretches out the vein walls and pushes against all those surrounding super sensitive tissues and nerves. And that whole biological cascade, that is what's creating that exact heavy, aching discomfort you've been feeling deep in your pelvis. So I want you to listen to this and tell me, does this sound familiar? You might feel this profound pelvic heaviness or aching that without fail gets way worse as the day goes on. Why? Well, gravity is essentially working against those pooling veins. That's exactly why the pain flares up after you've been standing in line or sitting at a desk for long stretches. You might also have visible vulvar or pelvic varicose veins, discomfort during intercourse, super frustrating urinary frequency, or even this lower abdominal bloating that just absolutely refuses to go away. If you're nodding your head right now, trust me, you are so not alone in this. Now, to actually treat this thing, we really have to understand why that traffic jam happens in the first place. You see, this isn't some mysterious, unexplainable pain. It's actually fundamentally a mechanical and circulatory issue. It's a physical breakdown in how your body pumps and moves fluids against gravity. Once we demystify that cause, the path to feeling better gets so much clearer. There are a few major life events and bodily changes that can trigger this kind of breakdown. Pregnancy, for instance, that drastically bumps up your blood volume and totally changes your pelvic structure. Hormonal shifts, like sudden spikes in estrogen, can physically dilate your vein walls. Even chronic constipation forces you to strain, which ramps up the pressure inside your abdomen over time. But here's the crucial missing puzzle piece for so many women. Congested pelvic syndrome usually happens when these weakened veins collide with severe pelvic floor dysfunction. That's the real kicker. To understand this, I really want you to think of your pelvic floor muscles as your body's built-in sump pump. These muscles sit right at the base of your pelvis, kind of like a supportive hammock. But they don't just hold your organs up. They act as this incredibly dynamic pump that sends venous blood and lymphatic fluid fighting against gravity, right back up towards your heart. When this muscular pump is strong and perfectly coordinated, it literally defies gravity. It pushes fluids right out of the pelvis so everything flows beautifully. Let's compare the two scenarios. When your pelvic floor is healthy, it contracts and relaxes rhythmically, almost like a heartbeat, efficiently pushing fluids upward and out. But what happens if those muscles become weak or chronically tight or just completely uncoordinated? Well, the pump totally fails. It's compromised. And without that pumping action, all those fluids have literally nowhere to go but down. They pool at the base of your pelvis, slowly stretch out those veins, and create that overwhelming, heavy pressure you're feeling on a daily basis. Let's break down the mechanics of a healthy pump in action to see exactly where things go off the rails. It's a simple three-step process. First, your pelvic floor muscles contract, which gives a natural, gentle squeeze to the surrounding veins. Second, that squeeze safely pushes the blood and lymphatic fluid upwards. But here is the absolutely critical third step. The muscles have to be able to fully relax to let the veins refill normally without trapping the blood. It's this beautiful, rhythmic system of contraction and release. But it only works when all three steps happen in perfect harmony.
Okay, stay with me here because this next part is a total game changer. You might be listening to this mechanical breakdown and thinking, all right, so the pump is broken. I clearly just need to strengthen it by doing a million Kegels, right? I promise you, this is the single most common question I get in the clinic. Because as women, we're basically conditioned from day one to think Kegels are the magic cure-all for absolutely everything down there. Well, the answer is a definitive no. Kegels are not always the answer, and honestly, they can actually be incredibly harmful here. Think about it. If your pelvic floor muscles are already chronically tight, holding a ton of tension, or uncoordinated, doing a Kegel is literally like trying to squeeze an already tightly clenched fist. If you just tighten them more, you're going to further constrict those veins, trap even more blood, and actively make your symptoms worse. Actually, you need a targeted, specialized approach to train those muscles to relax and let go first.
And that is exactly where specialized physiotherapy comes in, to actually treat congested pelvic syndrome safely and effectively. We don't just guess, we use specific, targeted techniques to restore your muscle coordination. We use gentle manual therapy to physically release those chronically tight muscles that are essentially holding your pelvis hostage. At OVA Women's Health, our physios specialize in exactly this whole shebang, combining biofeedback, really specialized breathing techniques that dramatically drop your abdominal pressure, and postural support to naturally get your circulation flowing again. If you take away absolutely anything from our time together today, please let it be this. Most women do not need surgery for congested pelvic syndrome. For years, women have been offered these extreme surgical interventions, or even worse, absolutely nothing at all. But pelvic floor physiotherapy is a primary, evidence-based, highly effective, non-invasive path to long-term relief. Your body really can heal when it gets the right mechanical support.
I want to read this directly to you because it's so important. Pelvic pain responds well to specialist physiotherapy. You deserve that care. You have navigated this complex, totally invisible pain for far too long, probably suffering in silence, just trying to push through your daily routine. You absolutely deserve a safe, validating clinical space where your pain is actually taken seriously from the very first minute you walk through the door.
And that is exactly where we step in. OVA Women's Health, located in Burnaby, BC, is a highly specialized clinic designed from the ground up entirely around solving complex chronic conditions just like congested pelvic syndrome. We aren't just some general practice where pelvic health is treated as a minor afterthought. We bring advanced, hyper-focused pelvic floor training and clinical expertise directly to your specific needs, your body, and your unique set of symptoms. So what makes the OVA difference so critical to your recovery? Well, we bring the clinical experience of treating over 2,000 complex pelvic pain cases. That's a lot of pelvic floors. We know that everything is connected in the body, so we focus on the whole holistic picture, how your circulation, your breathing patterns, and even your daily posture all dynamically interact with your pelvic floor. Women travel from all across the Lower Mainland to come to AVA because they know our assessments are deeply compassionate, completely unhurried, and 100% judgment-free. Look, you've been patient long enough. Real specialist help is out there, and getting your pain-free life back starts with just one single appointment. Go ahead and scan the QR code right now to book your first assessment with us at OVA Women's Health. We are here to help you finally heal and get your quality of life back. But I want to leave you with this final provocative thought to chew on today. Your body has been sending you these painful signals not to punish you, but to desperately ask for your help. So, are you finally going to answer it?